good to be here, and I'd like to welcome all of you to our Prairie Doc Radio program. Rick Holm, our Prairie Doc, is unable to be with us today, so I'm happy to welcome Deb Johnston, a family medicine physician with the Avera Medical Group Brookings. Hi, Deb.
Hi, Joan. It's good to be here.
Well, I would so appreciate you coming, and it's always an interesting show when you're here. Before we get going with medicine, I want to remind our listeners that they can live stream both the audio and video of our program on their computer. Deb and I both combed our hair this morning, so
Yes,
we're ready
we
to be
did.
on video. We are on the web at prairiedoc.org. Pull up the page, choose radio from the list at the top of the page, then you'll see the arrow pointing to our program today. If you want to watch previous programs, they're also listed there. So that's enough plug for the video. If you're on KBRK, listening on your radio, that's the way to listen, right? Okay. So Deb, that's it. How about medicine today? Do you have anything in mind you wanted to discuss?
Oh, let's just talk about anything anybody's interested in.
Okay, well, that's a real open call to all of you listeners. 692-1430. Get that phone ringing. Feel like we're raising funds or something. But we would like to hear whatever questions you might have of a medical nature. Before we get started with that, we'll give you time to call. One thing has really been in the news, and this is a question I have of Deb, is the Zika virus. I have two nephews whose wives are really concerned. They live in St. Louis. The wives both have one child, and they're both thinking they'd like to get pregnant again, and they're really scared. And then my sister-in-law was planning on taking them all to Florida in June. They're afraid to go. What do you think of Zika virus? And for especially when you have a lot of your patients who are pregnant age, right? Okay.
Reproductive age women. Yeah, I think that there's a lot we don't know yet about Zika virus. One thing that women in South Dakota, I can reassure you about, the mosquito that carries Zika virus doesn't live in South Dakota. So for those of us who live here, we don't need to be worried about this. Women thinking about traveling, particularly to South American countries, there's a lot we don't know, and it may be prudent to put off those travel plans, particularly again to Brazil and those environs, for a year or so we can learn more and figure out what your risks might be, what the risks might be. It is important to realize that it is still a minority of people that are affected by this. That doesn't matter if it's you that's affected by it in your family. That doesn't matter that, 1 in 1,000, or we don't even really know that information yet. It doesn't matter that it's a small percentage.
If you're the one.
If you're the one. So there's a lot we don't know about it yet. It just adds to that urgency of mosquito control and mosquito protection. I think those of us that are a little older remember West Nile, and when West Nile first was recognized and made its appearance, and how alarmed we all were about West Nile, and it's still there and we just don't think about it. So
Pretty well have it under control.
We understand a lot more about it now.
Well, my heart does go out to women who are of the age
Yes.
to get pregnant. I
Yes.
think it'd be just a horrible fear. It really would be.
I think so, and I think one of the big fears is we don't know how long, is it something that it only affects you when you get infected during pregnancy? Is it something that's going to affect you for 5 years later, for 10 years later? We don't know those answers. So
Okay.
I think until we know more, exercise some precautions. I don't know that I'd worry too much about Florida. There's not been much evidence for transmission in the United States yet. I think I'd go and probably try not to go pregnant, but I'd just be real cautious with the sunscreen and of course sunscreen, because that's my pet project, but the bug spray and cover up and
Protect
yourself from the
Well,
bug
these
bites.
people are truly aware of it, and that's good. And you have allayed fears of any women in South Dakota, because that
Yes.
really isn't present here.
It's really, we don't have the mosquito that it's been found in, so
Good to know.
we don't have to worry in South Dakota.
That's great
To the
news.
state of our knowledge as of yet.
Thank you. Okay, well, we need to take a break now, and as we mentioned, we'd love you to give us a call with any questions you might have. 692-1430. Give us a call. We'll be back right after these words. Hi, welcome back to Prairie Doc Radio. Dr. Holm is unable to be with us today, so I'm happy to welcome Dr. Deb Johnston, a family medicine physician with the Avera Medical Group Brookings. Deb has been our guest oftentimes on this program, and it's always a day brightener when she walks in the door. Glad to have you here. Now, you mentioned sunscreen just before we took a break, and I do know sunscreen is so important for people, but I wonder too about children. Sometimes they say younger ones. I don't know what the age. You know what to tell people for sunscreen.
You know, I think it's important to recognize that I particularly worry about sun exposure in children because, you know, unlike you and I, they have a whole lot of years to live in that skin. So burns that happen, sun exposure that happens to little people, in a very real way matters more than sun exposure that happens to you and I. So I do recommend that parents be particularly cautious about sun exposure for their children. Infants, you want to keep the sunscreen off of their hands because they don't want them eating it. Obviously, physical methods, covering up, staying in the shade, those kinds of things are a very important part of that sun protection. But I don't hesitate to use sunscreen on babies too. So you may want to look for the sunscreen for babies, but and some people get real worried about the chemicals. I just really recommend sunscreen.
Okay, and how about the level? You know, you can see it level 10,
Right.
level 15, which I think is a joke, but you tell me what you think.
You know, one of the things that I learned relatively recently about sunscreen is that the sun actually decomposes sunscreen. So you can put on SPF 50, but it's not going to last any longer than SPF 30 does. It'll block a higher percentage of the sun's ultraviolet rays, but you can't extend out the time. And honestly, SPF 30 is sufficient. You just need to remember to reapply and reapply and reapply.
Okay, so 30's the number. That's the one to go with. Sometimes the children's sunscreen, and I bought it for knowing my grandkids were meeting us in Florida, oftentimes the children is 50. But
yeah, and that's
okay.
It's okay. You're not going to do any harm getting the SPF 50. You're just going to spend more money.
Right. Okay.
So.
But maybe the children's sunscreen might be a good one to use. It might have less chemicals or something.
Well, sometimes it's a little more hypoallergenic. There may be less irritation to the skin. You know, a lot of times that's what you need to do is do a little bit of experimenting to find which one is easiest on your skin. The other thing to remember is that you don't want to use last year's sunscreen. You want to throw out and get new sunscreen because that chemical will degrade over time. So last year's sunscreen isn't going to offer you the protection that a new bottle will.
That's good to know. A lot of us will hold it over and...
Yep. I've been guilty of that too.
Oh, get rid of it. Okay.
Get rid of it.
Well, I trust that answers any questions people might have about sunscreen. We hope you all use it and definitely use it in your children. Yes. We had a call come in. Thank you for the call.
Yes.
And this person would like to know, what can we do to get allergy relief?
We are definitely in that season. So let's talk just briefly about allergy shots. You know, allergy shots are kind of our holy grail of allergy treatments. And I always tell people that I save allergy shots for people who have failed everything else because it's a huge commitment on the part of the person and there's more risks involved with allergy shots. The other thing is that allergy shots is kind of a specific treatment, so I have to know what you're allergic to in order to design that serum and to be treating you with that allergy shots. And I don't have a test, I don't have a Star Trek tricorder where I can run it over you and say, what are you allergic to? My allergist has to do and ask a specific question. Are you allergic to this? Are you allergic to that? And that's how we discover that. So if we don't ask the right question, we might miss something that you are allergic to. So what I recommend is kind of a stepwise approach for allergy treatment. Things like Zyrtec and Claritin and Allegra, I usually recommend those over things like Benadryl and chlorpheniramine, chlortrimeton, because those are far less sedating. Zyrtec and to a lesser degree Allegra can sedate a small percentage of people, but usually if you take them at bedtime by the morning, you're fine. So those are good first line therapy, and they work quickly. They'll kick in within half an hour to an hour, so they're a good thing to start with. If that's not enough, the next thing to add in is the allergy nasal sprays, things like Flonase and Nasal-Cort, and those are available over the counter now. The thing that you need to know when you're using those is that your nose doesn't go up, it actually goes back. So you think about the skulls that you see at Halloween, you don't want to aim up towards the top of your head, you want to aim back, kind of towards back behind, towards the middle of your ears. They also can cause some nosebleeds, so I usually recommend what we call the cross hands technique, where you use your right hand to spray the left side of your nose and the left hand to spray the right side of your nose. You're trying to aim straight back, but this just kind of keeps you from angling just a little bit and spraying right on that septum, the middle part of your nose. Using a neti pot, which is kind of that nasal saline irrigation to wash the allergens out of your nose, that can be really helpful. Every time I tell somebody to do that, my toes curl a little because it sounds like the kind of thing they do to me in Guantanamo Bay. But
people may not know what a neti pot is. It looks like a little teapot, doesn't it?
It does. It looks like a little teapot or a little gravy boat, and you mix up a buffered saline solution, and you pour it in your nose, and you pour it in one side and it goes out the other. And my patients who do it love it. They say it makes them feel really good. I have little kids who do it and will come dancing down the hall and tell me, Dr. Deb, I love my neti pot, because it keeps their allergies and sometimes even their asthma under good enough control that now they can go outside and play, and they never used to be able to do that. So I figure, if my 10-year-olds, my 8 and 10-year-olds can do it, I could put on my big girl panties and do it too. But it is something that a lot of people find really
would you do
disturbing.
the neti pot along with taking a pill?
I would. This is
it
kind
enhances it.
This is kind of a mix and match sort of
Okay.
things. I mean, some people find that they need to do this collection. Some people find they can do one. Some people find they can do two. Some people find they need to do all of them. I would not do the nasal spray and then the neti pot. I'd do the neti pot and then the nasal spray. Okay. And then there's another medicine out there called Singulair, which is available by prescription, which I will add in for people as well, and that can be a valuable allergy medicine. It's also used for asthma. So those are kind of our bag of tricks before we get to the allergy shots. And of course, the big thing is control of exposures. So if you're allergic to the cat, Fluffy shouldn't sleep on your pillow. If you're allergic to the elm tree outside your window, don't sleep with the window open. Those are just very common sense things. Reduce the exposure you have to
We didn't
those
have air
allergens.
conditioning when our kids were young, and we had one son with extreme allergies, and we finally got a window air conditioner just for his bedroom. What a difference
Yeah.
it made. Now the other kids wanted to come in and sleep in there
in
on
his
hot
room.
nights, but that was all right. He would just close the door and have that air-conditioned room, and it was amazing the difference that made. So.
Having carpet can, hold on to those allergens, and so having hardwood floors can be helpful. There's all kinds of local infection or allergen control measures you can take that can be really helpful and really important.
I have another question. Since we're talking about allergies, I took Claritin for a number of years, seemed to be less effective, and I switched to Allegra. They're very similar, but I found more effect. Can you just kind of stay on one too long and maybe switching might help?
I hear that reported from patients a lot. I am not aware of studies that
would show
validate
that.
that,
Okay.
but I hear that all the time from people that this one stopped working, and so they started using that one, and then that one started working, and they just kind of rotate through them.
It's okay to do that
It's
then.
okay to do
Right.
that. Some people also get some benefit from adding in pseudoephedrine, the D on Claritin D or Zyrtec D. Some people have trouble sleeping. That's when they do that. So that's just another thing to mention.
All right. Well, I think the person who called in with allergies certainly got a thorough
Earful.
answer. No, a thorough answer. And again, for those 3 meds that Dr. Johnson suggested to begin with. It was Allegra, Zyrtec, and Claritin, in case they didn't catch that.
And in my family, we buy the generics, so don't think that you need to get the brand name. The generics are just fine.
Okay, well, we're due to take a break. We appreciate the calls. If you have any other questions, give us a call at 692-1430, and we'll be back right after these words.
Clear.
In the studio with me, in Dr. Holmes' absence, is Dr. Deb Johnston, who is a family practice physician at the Vera Medical Group Brookings. Deb, good to have you here.
Good to be here.
Got another question. I think they know that you deal with children. So our question comes in. I've read that fish oil helps improve children's attention and focus, especially helpful for children with ADHD. Fish oil is the omega-3 fatty acids. We hear about it all the time. What do you think?
I am not aware of any randomized, controlled, blinded studies that support that. So I'm not aware of any quality data behind that. Now, having said that, I think there is a lot of data to say that those omega-3 fatty acids, particularly from fish, are important to well-being and health. Particularly if you get them from diet as opposed to from pills, but as hypocritical as it is for me to say it, I really don't like fish. So
I love fish. I don't like fish.
I appreciate people who like fish, but I'm not one of them. So
isn't it in your Italian DNA to like fish?
You would think so, but
I would guess. I'm surprised.
I know.
Okay.
I'm a bad Italian, I guess. But no, I think there's nothing wrong with that fish oil, and those omega-3 fatty acids can help with bowel movements. And I think good nutrition in general is good for just that mental well-being and that concentration. And another thing that can be really helpful is making sure that a child is getting adequate sleep. But really, when you have a child that truly has ADHD, that's a child who is just inundated and can't tune out all the things that the rest of us can tune out easily. The noise in the background here, the cars going by, the chairs creaking, they're on constant alert and getting distracted by that from what they're trying to focus on. They can't filter out what's not important. So there's some good data out there to say that parents can learn how to help their child focus, how to that some therapy, some behavioral therapy, some parent technique training for the parents can help that child. It's very work intensive, it's very time intensive to help that child learn how to focus on what's important. But it really comes down to needing medications for a lot of those kids. Some of them will learn strategies over time and self-select into fields where they don't have to have that close focus and attention, but a lot of them just are going to need medication.
Okay. Well, I'm not a fan of the medication for ADHD, and I know parents suffer with this and don't know which way to. It's really a tough thing.
It is. It's a really hard thing, and nobody wants to give their kids medication, particularly those medications, because they're controlled substances, and it's just a hard thing. But they can be truly revolutionary for kids. I mean,
can be very helpful.
They can really turn a kid who spends all night struggling to do their homework into a kid who is getting getting really good grades and feeling a lot more optimistic and a lot happier and a lot more confident in themselves. A kid that really has ADHD is at a much higher risk for developing a lot of other issues because they start thinking that they're stupid. They start getting socially isolated because they are too distracted and impulsive, and particularly as they get older, other kids start not liking them because they can't read those social cues and they're not following those social skills, and they're blurting out, they're interrupting, they're impulsive, they're pushing, they're shoving.
So they become even more isolated.
So they become more isolated. And so, it's not just about helping that kid get good grades, it's helping that kid be successful and removing a barrier. It's, in a way, you can think of it like, well, I don't like wearing glasses either, but boy, if I'm not wearing my glasses, I better be right up on top of the teacher or I'm not going to be able to read the board. Now we don't have chalkboards for our kids, but the point still being that it's sometimes it's just a tool that child needs in order to learn what they need to do to go on to the next step.
Have they discovered, these drugs have been used for at least 20 years now, I think, for kids.
Far longer.
Okay, have they discovered that they reach an age where they go off the drugs and don't need them any longer? I'm curious about that.
There are a percentage of children that kind of grow out of it, but current research really indicates that this is a genetic condition. It's not something that they necessarily will grow out of. So there's a significant percentage of people that still have those issues as they get older. They learn to adapt, they learn strategies to kind of compensate for it. And again, some of them will go into fields where it's not such a big deal that they're multitasking all the time, or getting distracted all the time. So not all people need medications
Straight through their life.
But adult ADHD is an increasingly recognized issue.
So there are, I'm sure, quite a few adults who were never diagnosed as kids and wondered why they were never successful in anything they did, and they get on these meds and it makes a big difference for them. So there are positives for it. There are positives and negatives in everything you do.
Absolutely.
Well, we're going to take our next break. We appreciate these comments from Dr. Johnston, and if you have any questions, give us a call, 692-1430. We'll be back right after these words.
Clerk.
Welcome back to Prairie Doc Radio. If you've been listening this half hour, you've gotten the advice of Dr. Deb Johnston. In Dr. Holmes' absence, we're happy to have Dr. Johnston here. We've had some questions that relate to young people. We usually don't get those with Dr. Holmes because he doesn't treat young people, and Deb Johnston is a family practice physician, so of course she has all ages and does have quite a few children in her practice. We have a question about concussions, and this is really something that's so important now, and we're learning so much more about them. What advice do you give to parents of athletes who have sustained a concussion? And really, it doesn't have to be just athletes. Correct. Kids in a playground can get a concussion. Yeah. What do you think?
Yeah. I think it's really important to protect that child's brain until it's fully healed. And that is a lot longer than we used to think. And it's not something where you can say, 2 days, 1 day, a week. I mean, you really need to watch and see how that child's brain heals. So there's not a one-size-fits-all answer to that. It depends on the age of the child, the plasticity of their brain, the severity of the injury, and you can't necessarily tell that by saying, well, what was the injury? So there are testing that the athletes here in Brookings go through to kind of get an idea of how quickly and how robustly their brain works, and when they get a concussion they will go through that testing again, and that gives us an idea of when their brain is back to baseline, and I think that that's a really important thing. If we don't have that testing ahead of time, we can use kind of standards for that child's age and kind of academic performance, and there's some physical standards that we can use, some physical landmarks. I know I had a young lady at one point who'd had a concussion, and she was a skater, and what was really dramatic is she kept saying, well, no, I feel fine, and then I had her try to balance on one leg. You know, again, she's a skater, and she's a pretty good skater, and she couldn't do it, and that was just a very, very dramatic proof to her and her parents that no, she's not ready to go back. That brain is still healing. So basically, if there's a concussion, if there's a question, go in and see your doctor, and don't push it, because if you push it, that return to normal is going to be longer. That brain needs rest to heal.
Okay, great advice. We don't have a lot of time left, but we had another call come in, and a caller would like you to talk about 6th grade meningitis vaccine.
You know, I love to talk about shots.
You do?
I do.
All right.
I love to talk about shots.
6th grade meningitis vaccine.
So the meningitis
Tell us about
vaccine, you know, we historically we have given this vaccine kind of at college entry. And recently, the CDC, the Vaccine Advisory Committee, the people who the experts that make these recommendations, there's been a little bit of shift in the demographics of the disease, and we're seeing, and some of that may be because we've been successful with the vaccine at reducing the rates in college. They've recommended that we start giving that vaccine at middle school entry. Now, this doesn't protect from all the types of meningitis under the sun, but it protects from particularly virulent, particularly dangerous forms of meningitis. So there is a recommendation at middle school entry for a vaccine with that meningitis vaccine. And also we administer a booster at college entry with that one. There's also a recommendation for the tetanus booster, the pertussis whooping cough booster at 6th grade entry. And the other thing that I really encourage parents to do at 6th grade is to get started with the human papillomavirus vaccine, the Gardasil vaccine, to protect their children from infection with a virus that can cause cervical cancer, vulvar cancers, anal cancers, penile cancers, and throat cancers. So there's a lot of vaccines to be thinking of at that age group.
I haven't had a 6th grader for a lot of years, but when they enter 6th grade, is there a set number of, do they have to see a doctor before entering 6th grade? Is there some setup there?
You know, there's not. There should be, but there's really not.
Okay, so if they're going to get these, the school just recommends it and then they go see their doctor?
My understanding is that there's a new law that says that particularly that tetanus vaccine is mandatory. And the school actually had a vaccine night that kids could participate in.
Okay.
But encourage your children, your grandchildren, call their doctor, get in and get the shots.
All right, that's great. Well, we have really enjoyed this. I have enjoyed this program, and if I enjoy it, I usually figure the listeners are enjoying it. So we hope all of you have enjoyed our Prairie Doc Radio program. As always, you can hear more from Dr. Holm online at prairiedoc.org, where you may also learn more about the exciting activities of the Healing Words Foundation. Thank you, Dr. Johnston. It has been great to have you here today.
Thank you. It's been wonderful to be here, Joan.
Okay, and thanks to all of you listening to Prairie Doc Radio. I'll close with Dr. Holm's weekly reminder. Stay healthy out there, people.